All right, Andy Johnson, we are looking at substance use disorders and we're focusing on adolescents here. Approximately 9% of adolescents are considered in need of treatment for substance abuse of some sort. 22 million Americans, and that's 12 years or older, meet the criteria for substance abuse. The peak drug use for illicit drugs is in late adolescence, those high school years, and early adults. So a breakdown of ages, those who have reported using illicit drugs in the past month, you see 21 to 25-year-olds, 19%, 18 to 20, 22%, and you see the age breakdown there as well. Now, marijuana is the most common illicit drug. This is very harmful for the developing brain. Marijuana use or extensive marijuana use has been linked with reduced IQ scores, deficits in working memory, attention, motivation, and self-regulation, as well as deficits in psychosocial functioning, interpersonal interaction, social situations, intrapersonal. And this is the age, adolescence, where you are learning how to work in these situations. 2013 survey, those reported using illicit drugs on at least one occasion, breakdown by grades. 12th graders, 50%, 10th and 8th graders. Alcohol use in the last month, 12th graders, 39%, 10th graders and 8th graders. So you can see that this is an issue in high school and middle school. 23% of high school seniors reported driving under the influence of alcohol or marijuana. And a breakdown by age, those reported driving under the influence, and you see it. 21 to 25-year-olds, 22% have reported driving under the influence at least once. 18 to 25, 16 to 17-year-olds, you see it right there. Males twice as likely as females to drive under the influence. Breakdown. Now, the neurobiology. Why is, well, marijuana especially, but drugs so harmful to the developing brain? Dopamine, that neurotransmitter that helps to regulate motivation for behaviors that are necessary for survival from an evolutionary perspective. For example, food intake, sex, social interactions, they all increase the dopamine levels. That leads to a good feeling. Ooh, that feels good. So it leads us to do it again. And from an evolutionary perspective, these behaviors, we were rewarded at feel good, dopamine levels, so we would do it again. And all these things enabled our species to evolve and develop. Drugs make us feel good. It's that dopamine effect. It reinforces the behavior, but it also reinforces addictive behaviors. So with continued drug abuse, over time, the dopamine receptors decrease. That means the dopamine neurons turn our attention to what salient funds that are important for our survival, but with lower dopamine levels, drug abusers experience less of a signal from the firing dopamine neurons. So the natural reinforcers like food and sex, getting A's on report cards, sports, social interaction, these things are less reinforcing. So it lessens motivation from a neurobiological point of view. A 25-year longitudinal study looked at adolescents who began using marijuana prior to the age of 21, and they found that high levels of marijuana use in adolescents were related to worse educational outcomes, lower income, greater welfare dependency and unemployment, and less relationship and general life satisfaction. As well, let's look at tobacco. Finally, tobacco leads to 500,000 deaths a year. All right, this is the end of part one. We just looked at some basic facts and figures related to substance abuse disorders.